This is Howard Walensky for Skype, talking to Frank Titus with Titus Motion Therapy in Los Angeles. And Frank, good to talk to you today. And what is Titus Motion Therapy and what is kinesiology?
Well, Titus Motion Therapy is a treatment method that I've developed over the past 15 years that really attacks the problem, the reason why you're having a symptom rather than what the symptom is. And a good example I tell people a lot is that if I put a rock in your shoe and tell you to go for a walk, you're gonna start to compensate to get away from that rock or that pain, and that your opposite hip might start to hurt. Well, most treatment plans, when you go in and you say my hip hurts, they're going to work on that hip. They're going to work at the symptom area. And I tell people what I'm going to do is get the rock out of your shoe, because no matter how much you treat that hip, until you get the reason why, which is the rock, out of the shoe, that symptom is going to reoccur or get worse, or it could be a short treatment plan. With Titus Motion Therapy, we treat the problem, and it's a much longer fix than just a temporary, band-aid.
Well, and Frank, the patients that you have, where do they come from?
They come from all over. Mostly it's word of mouth, but lately I've gotten some videos on YouTube and such things like that. And so word of mouth is the best treatment, or the best way to get to patients, though.
And you treat a lot of people remotely, don't you?
Yes, I'm seeing people more and more. We used to, as I told you, see people through video. And I typically see people once a week for 8 weeks. It's a pretty short treatment plan. Um, and through the video, there's a lot of lag time. I really could only see people once every 3 weeks or so, because we would videotape the people, or they would videotape themselves, send it to me. I would videotape the exercises, have to send it back to them. So there was a lot of lag time and a lot more expense than there is with Skype.
What, how does Skype work for patients? Can you see them in real time? And
That's the great part, is it's an immediate treatment of the patient in real time. And with the video, you couldn't sit here and ask questions like you can with Skype. So people can ask questions immediately about the exercises, or they can ask me questions about their symptoms and their progress and things like that. So it is really amazing way to treat people. I don't do any hands-on manipulation, so it's all um, exercise based and movement based and stuff like that.
it sounds like Skype can increase your productivity and can get your patients better faster.
Yes, much faster. Before it could take maybe 6 months, and now it can take 8 weeks, 2 months. So it's really cut down on that. And like I said, the uh, the the cost as well, the mailing and buying of videos and all that stuff. Now you don't have to do that stuff.
Now, when you are treating a patient or seeing a patient, I guess is more accurate. Well, I guess it's both. You can have them walk across the room and you can see them and diagnose them and suggest what they do.
That's correct. I evaluate people's symptoms, their posture, so I can look at all four sides of their posture. I have them walk, so I can watch their gait pattern and their movement patterns. And also, with the Skype, I can even do some simple little tests, like standing on one foot or squatting, and see how they react to those movements as well, which, it's not as easily done through video. So it really has helped a lot. And I think it helps the patient to understand and see the movements and ask questions during the movements rather than the video. So it is a lot better, I believe.
And are you now able to draw from people around the country or even the world?
Yes, I've seen people in the country, in New York and New Jersey and Colorado and Northern California. We just saved a lady from knee replacement surgery. And then I've seen people as far away as New Zealand, Australia and New Zealand.
So this is pretty revolutionary for your business.
Yes, it's been very interesting and exciting, because you can treat a lot more people. And in the future, I can treat maybe groups of people, or teach this to groups of people all through Skype too, like a webinar or something like that.
So Frank, how do people go about finding Titus Motion Therapy?
Well, you can go to titusmotiontherapy.com. There's actually some videos on YouTube. We also have a Facebook. So we're trying to get on the internet. On the YouTube, we did a show for PBS, and that's on there. And then a local news, KTLA here in Los Angeles, that little clip's on there as well. But you can just go to titusmotiontherapy.com.
Well, I appreciate your taking